We are now going to hear from our insight from our final panelist, Dr. Brent D. Martin.
I loved your comments. Is that on? I loved your comments. Thank you, President Underwood. What a great introduction. I'm a little bit of an enigma because I'm not against anything except continuation of the current state. I'm not against the insurance companies. I've been there. I know how they work, top to bottom, inside and out. I know the benefit that they bring. We can say whether that's big or small. But right now I am blessed and fortunate to work with an FQHC. There's about 1,500 of us FQHCs, federally qualified health centers. We are so fortunate because both sides of the political aisle believe very strongly that we are a large part of the answer to the problem. It makes no difference, red, blue, green, which side, I don't care what you sit on. Almost everybody believes that we are a big part. So my day is consumed every day with people that are not fortunate enough, for the most part, to go out and avail themselves. 82% of our population is covered through either Medicaid, SAGA, or some other program. 18% of our population at Charter Oak has no insurance. We have a wonderful African-American president, Alfreda Turner. Probably some of you know Ms. Turner. She's been with us 20 years. She and the Charter Oak board established the policy. Nobody gets turned away because of their ability or inability to pay, period. So we every day have people that don't have money for a bus token, and we're still going to see them. We have people every day that for their children that need behavioral health, and we're still going to see them. We have 40 walk-ins every morning come in who are in acute need, and the fact is they can't get their care hardly anyplace else. And that's what we're going to fix in our health center. So that's what I do every day, is I run the operations for medical, dental, and behavioral health. Let me just tell you a couple of things specific to the Bacchus plan, because I think that's what our focus is supposed to be. We don't know what it's going to be. The truth is we don't. 2 weeks ago, there was 460 amendments still had been proposed to the Bacchus plan. They've been in a caucus all week, and we flat don't know what's going to come out. We don't know when they merge the way our political system, whether it will be more like the House bill or the Senate bill, and we don't know. So anything that I say or that we say is somewhat speculation. With the FQHCs, we are fortunate that we get to spend a lot of time with our elected officials. You know, Senator Dodd has been there 3 or 4 times in the last 4 or 5 months, and so we are blessed to get a little bit of insight from his personal perspective as he has assumed the role after the passing of Senator Kennedy. As you probably many know, Doc Fix failed on Wednesday. If you don't know what that word means, Doc Fix is the attempt by the U.S. Congress to address the Medicare fees for providers. There was a bill put in place that there would be an adjustment where the rate that we pay Medicare providers would automatically adjust. I'm going to use the cost of living or inflation. It's not right, probably the right term. That would have required the fees to go down by 15% in January of 2010. Now, 40% of the people in the United States, of the providers in the United States, already don't accept Medicare. So if you lower the fees, what's going to happen? The less are going to accept it. So there was an attempt, but it failed to rectify. Congress does this almost annually. I think the bill was Bill 1776 or something like that, and it failed this week. So we still have a big problem. That bill is separate from the Bacchus bill on the healthcare reform, but it is still a huge expense. That's your money. It's not Congress's money. It's your money. And what are we going to do with it? So Doc Fix failed. We'll see where that goes. One of the things that is very troubling to those of us is that proposed in the bill, and you can fill this building with both proponents who either deify or vilify what we're trying to do here, is the Medicare cuts. $400 billion proposed in Medicare savings over the next 10 years. Where's that going to come from? You know, right now, if you talk to the CEO of Hartford Hospital, he says he gets 56% of his costs. Maybe his costs are too high. Maybe he's not reimbursed right. A fundamental great point for discussion. Another concern that we probably should put on the table is that there is a proposal in the Bacchus bill for the excise tax. Just to help me for fun, how many of you have traditional health insurance through an employer? Would you raise your hand? I do. Okay. The excise tax is a method to fund proposed method to fund the reform for the so-called Cadillac plans. The so-called Cadillac plans excise tax under the current legislative proposal would kick in at $8,000 for an individual or $21,000 for a family of 4. Now what would happen there is the employer would be assessed a 40% tax on that employer premium because of the Cadillac plan. That is one way to raise revenue to offset the bill. Now, right now, by the Congressional Budget Office, it appears that our current costs are around $16,000 for a family of 4. By the time you do medical, dental, behavioral health, LTD, STD, we're right around 16.5 now. So what happens then if this gets up to $21,000? What would you do if you're an employer? You're going to cut benefits back.
That's right.
So the reality is, if we have these benefits as we raised our hands, if the excise tax in the state that came in the proposal in the box bill, it's highly likely that employer health benefits, to avoid that 40% tax, will be cutting back our benefits. Is that good? Is that bad? It's up to you guys to decide. I'm not telling you that. I'm telling you what the facts are. All right, I think the Q&A is going to be more valuable, but I am blessed. I am fortunate. I've been in private practice, but I spend 10.5 hours a day now trying to do the right thing for the unserved and the underserved population, and I love it. Thank you.
We'd like to thank all of our panelists for their very mind-provoking statements. And so now we would like to open the floor for some Q&A.